The purpose is knowing the ranges for vital signs for your child can help you notice problems early or relieve concerns you may have about how your child is doing. The first infant vital signs is the respirations. You can count on the child respirations by putting your hand on the baby's chest and feeling how often the chest rises and falls. You can measure the baby's heart rate by feeling their brachial pulse, which is the pulse inside the crook or bend of the arm on the baby's pinky finger side of the arm. Next is the heart rate is a measure of how many times the heart beats in a minute. To count the heart rate, you want to make sure that you are using the appropriate size diaphragm and bell. And for an infant, we're using an infant size, and for an infant who is less than a month, a normal heart rate is 100 to 190 beats per minute. To find an apical pulse, what you wanna do is you want to find the fourth intercostal space lateral to the mid-clavicular line. So you want to find the clavicle, and then we have the breastbone. Go down, fill in between those little ribs and go to the fourth space. Then just go to the lateral to the mid-clavicular line and go to about right and where it is about the apical pulse of infant, and place the stethoscope there, and we're gonna listen for 1 full minute. The third infant vital signs is the temperature. To check the thermometer, make sure that you turn on the thermometer, and then you're going to place the tip of the thermometer deep inside the fold of the armpit. And then you're just going to put the arm down and wait for the thermometer to beep and tell you the reading. Next is the weight. To obtain the weight of an infant, you want to remove the infant's clothing and any soiled diaper. A dry diaper can be used. So place the infant on the scale and obtain the weight. You can document the weight and look for the infant previous weights. The fifth vital signs is the length. To measure the length, what you wanna do is you want to lay the baby on a surface that you can mark. You'll need a pen, and for this, you may need someone's help to help you measure the baby because you're going to measure from head to heel. So, lay the baby back. You'll want to put the head midline and then just mark the head and take the leg and extend it outward. Make sure it's nice and extended, and then mark it all the heel. Next is the head size. To measure the head circumference, we're going to need a measuring tape, and then you want one to measure in centimeters. What we want to do is we want to place the tape measure around the largest diameter of the head. So to do that, we're going to place a little bit above the eyebrows, and we're going to wrap that around and place it around the most prominent part at the back of the head. Gently just lift the head up and put the measuring tape behind, and then pull your measuring tape around. The last infant vital signs is the chest size. To measure the chest circumference, you want to get your measuring tape again. You'll be measuring this in centimeters, and you're gonna take it and use nipple line as your guide. So wrap it around there and then measure it.